When you move on from exploring the patient's main medical problem, your next step is to systematically delve into all their medical issues. Often, the medication list you reviewed earlier provides important clues to the full spectrum of the patient's conditions. By clarifying the indications for each medication, you should already have a preliminary list of their medical problems, which you can now use as a roadmap for further exploration. Begin by prioritizing the problems based on key principles. Focus first on issues that are closely related to the patient's main problem, as these conditions may directly influence or complicate the primary complaint. For example, if the patient's main problem is refractory angina, pay close attention to any related conditions, such as poorly controlled diabetes or dyslipidemia, even if these appear to be well managed at first glance. Recognizing these interrelationships helps you identify which issues require urgent attention. Next, concentrate on the active problems, those that are currently causing symptoms or have the potential to worsen rapidly. Utilize specific templates if available for particular conditions. These guides will help you ask the right questions and ensure you cover all the key aspects of that problem. In many cases, a general template similar to the one used for the main problem can be adapted for other active conditions. This ensures you gain a clear understanding of the severity and current impact of these problems on the patient's overall health. Once you have addressed the more pressing active issues, shift your focus to inactive or stable problems. These are conditions that may be well controlled with medication, such as well-managed hypertension, or chronic issues that have remained stable over time. However, even if these problems are not actively causing symptoms, it is important to note any significant events from the past. For instance, if a patient previously experienced a hypertensive emergency but now maintains stable blood pressure, this historical detail is still clinically relevant. In your documentation, you can either incorporate these inactive problems into the main narrative or list them in the past medical history section, along with a brief comment that they are stable or well controlled. A structured documentation template can help you systematically cover all aspects of the patient's clinical history. Start by documenting the initial presentation, noting the timeline, presenting symptoms, and the context in which the problem was first identified. Then, list any relevant risk factors that might predispose the patient to certain conditions. Connecting these factors to potential diagnoses. Detail the diagnostic process by recording key physical signs and investigation results that confirm the severity and nature of the condition. Also, outline the treatment course, from initial intervention to current management, along with any adjustments, side effects, or complications such as hospital admissions. Finally, evaluate the current status of the disease by describing how it affects the patient's daily life, including the emotional, psychological, and social impacts. And document the follow-up process by noting the frequency of monitoring and any ongoing care strategies. By integrating the patient's narrative with your clinical assessment, you create a comprehensive and coherent clinical picture. Begin by documenting the patient's reported main complaint. Then transition into a detailed exploration of each identified problem. Use your clinical judgment to probe further into issues the patient might not have recognized as significant. For example, while the patient might report chronic fatigue as their primary concern, your evaluation might reveal that this fatigue is secondary to an underlying endocrine or cardiac issue. Clearly explain how these additional problems are interrelated with the patient's initial report and why they are critical for both prognosis and management. In summary, after exploring the patient's main medical problem, systematically investigate all their medical issues. by prioritizing those closely linked to the primary complaint and those that are active and severe. Follow this with a brief review of inactive or stable conditions that, while not immediately concerning, remain relevant to the patient's overall health. Using a comprehensive documentation template ensures you cover every element, from initial presentation and risk factors to diagnosis, treatment, complications, current status, and follow-up, thus strengthening your case presentation and enhancing your diagnostic reasoning. This methodical approach supports the development of a thoughtful, integrated clinical management plan and lays the foundation for excellent clinical practice in your future career.